Now I'd love to move on to one of our other guests, Louisa Nicholl. So Louisa is coming on board as a good grief volunteer, and Louisa is a palliative care nurse, and sadly she lost her husband. But she's hoping to be able to bring parts of the community together for a Better Together cafe during National Grief Awareness Week. So Louisa, welcome.
Hello there. Thank you so much, Linda, for asking me to speak today. And I am talking really from a personal perspective, from the fact that my husband died 3 years ago. I'm currently not actually working within palliative care, but trying very hard using my time and my experience to try and influence care, and particularly around end-of-life care and bereavement, from having both perspectives on this. So I'd worked as a palliative care CNS and a hospital ward manager for most of my nursing career, and I thought I knew how important collaborative working was. But as I said, 3 years ago, my husband died at home, and I experienced it from a different perspective as a wife. Over the course of John's illness, I think he was actually he had osteosarcoma for 4.5 years, and I think you often become quite the link between the healthcare professionals. But I've got a few examples of that. But one example in particular was when a district nurse contacted me that had asked me to see if I could get the clinical nurse specialist in palliative care to change one of John's prescriptions because it was incorrect. And as a wife, I didn't really think that that was my place to do that. And actually, I didn't really want to be doing that, as as I said, not as a professional. So I suggested that she might want to contact the CNS herself. And I think what surprised me most of all was that the specialist nurse worked out of a hospice locally. The district nurse obviously worked locally, and she didn't know how to contact the clinical nurse specialist, and she didn't know how to contact the hospice. And for me, that was really quite difficult because this was just 2 days before John died. And he'd actually been under both services for up to about 5 or 6 months prior to that. So I think for me, with the Better Together Cafe concept, I think my feeling is as a relative, but also with a professional hat on, that if the district nurse didn't know about the hospice and the services that it provided, how many people may have missed out on some of those services that might be required. So I think for me, the Better Together Cafes is an opportunity to bring professionals together, and in doing so, enable them to share knowledge, skills, and experience, but ultimately improve the outcomes or the experience for patients and their relatives. As Dame Cicely Saunders said, how people die remain in the memory of those who live on. And I think for me, having been a palliative care nurse for many years, having experienced the actual bereavement myself has given me a very different perspective on it. And I think the Better Together Cafes are a really good way of trying to get professionals and people's personal experience to come together. So I'm hoping to use some of my experience from both perspectives to ultimately sort of help bereaved people in similar situations to what I found myself in.
Wonderful. Thanks so much, Louisa. I mean, please do comment in the chat about it. But as Louisa said, it's so key for health professionals, community services. We're working very closely with the school nurses, with the district nurses, with the health visitors, who are often left without that sort of knowledge and information and experience for the bereaved. And they also need those resources, and they need that signposting and connection with other services. So it's absolutely key what you're doing. So thanks so much, Louisa, for everything that you're offering for National Grief Awareness Week. We're really excited to see how that pans out later on in the year. And as I say, if you are organising an event, please do let us know in plenty of time so that we can start promoting it for you and get as many people there as possible if that's your aim.